Hi, I'm Erin Doherty, the Director of Nursing Practice for Acute, Complex Care and Rehab Services at St. Joseph's Healthcare Hamilton. As St. Joe's gradually resumes healthcare services such as surgeries, medical procedures, and clinical programs, our primary focus during the COVID-19 pandemic is the health and wellness of our patients, staff, and community. While not business as usual, rest assured the hospital has a plan in place to ensure that the sites you visit are safe for care. When visiting or arriving to the hospital, the public and staff will be screened prior to entering. Masks will be provided and are expected to be worn while inside. We have implemented physical distancing measures and various checkpoints to ensure hand hygiene is maintained. As part of our plan to care for you safely and responsibly, here are a few changes you can expect to see when visiting various sites. We have limited the number of entry points into our Charlton, West 5th, and King campus sites, where everyone entering the hospital is screened for COVID-19. Please see our website for patient entrances. Upon entry, you will be asked to apply hand sanitizer and answer a number of health-related questions. You'll also be screened for symptoms of COVID-19, including fever, cough, and difficulty breathing. Those who do not meet screening requirements will be identified by their wristband. Our screeners will contact their clinic, where these patients will be directed for further assessment. If you are feeling unwell prior to your appointment, please call your care team for further direction. Upon entry to the hospital, you will be issued a face mask to wear to help keep you safe while reducing the risk of possible COVID-19 transmission, in addition to other viruses and infections. Here are some helpful tips to ensure the proper use of a face mask. Ensure that you apply hand sanitizer before putting on your face mask. Wear your face mask safely and snugly to cover your nose and mouth without any gaps. Keep your face mask on at all times throughout the hospital. Upon exiting, sanitize your hands before removing your mask and dispose of the mask in a lined garbage bin. Clean your hands after removing the mask. Consult your care team if you have a disability or a health condition that might be impacted by use of a face mask. In addition to wearing a face mask, keeping a safe physical distance while you're in hospital can help reduce the risk of COVID-19 and the transmission of other viruses and infections. This means staying at least 2 meters apart from others in lobbies, waiting rooms, and public areas which have been configured to encourage physical distancing. To make it easier to keep a distance, pay attention to signage, barriers, and other markers throughout the hospital. Understand that seating in public areas, including in food service areas, is limited and discouraged at this time for your safety. Avoid arriving to your appointments too early. Clinics have carefully scheduled appointments to limit the number of people in the hospital at all times and to make physical distancing easier. Don't forget to practice hand hygiene when entering and leaving a clinic to prevent the spread of COVID-19. Good hand hygiene remains critical in curbing the spread of COVID-19. Take advantage of various checkpoints throughout the hospital to apply hand sanitizer and ensure hand hygiene is maintained throughout your time in the hospital. These checkpoints are accessible upon entering and leaving the hospital, as well as arriving to and departing from the clinic of your scheduled appointment. As we work to gradually reintroduce services, we thank you in advance for practicing measures to prevent the spread of COVID-19. With your help, we can continue to provide safe and responsible care during this pandemic and beyond.